So the current coronavirus epidemic or pandemic is, these are challenging times for everybody for sure. And certainly in my lifetime, I don't think there's been anything like this really since about 100 years ago, for most Western societies anyway. So our practice, our aim is where possible to keep open and keep providing a safe service to our customers. We have a vested interest both in being safe for our customers, but also in our household, my wife is immunosuppressed and has a lung condition. So it's very important that I try and stay healthy as well. So we are looking at all the recommendations within Australia. We're also looking at all the recommendations in countries, for instance, Singapore, which have coped with this so much better than, say, Italy or the USA. So we're looking at what they've done and why they've been successful. So although our general cross-infection control, the things that we do on a day-to-day basis are good for general viruses, this one we do have to take more seriously. The things that you will notice as you enter the practice now is that we have multiple signs before you enter the practice. Basically, if you're sick and possibly you've got a dry cough, a temperature, things like that, we don't want you coming into the practice. We actually want you to phone us up and we'll advise you from there. I think most people have got that from the media now, but just to make sure, also people who have been to China and some of the hot spots, we don't want them coming into the practice. We want them to phone first and we'll advise from there. Once you enter the practice, one of the first things we'll ask you to do is to use some of that rare alcohol hand gel that is hard to get, but we have a supply of it, and so we as clinicians are using that exactly as Hand Hygiene Australia recommend. And we're now asking our patients and customers, basically anyone who enters the building, and as we enter the building, we also are using that before we walk through the rest of the building. So we're using that. We will now take temperatures, and if your temperature is above 38 degrees, we will pop a mask on you and we'll actually ask you to go away and come back when you are fit and healthy, and probably go and see your GP and find out what's wrong with you that's causing you a high temperature and take it from there. Happy to see you once you're fit and healthy. What we know about this virus is that for most people it's going to be like just another flu, but for some people, and it's the vulnerable people, sometimes not vulnerable people, it can kill, and so we have to take it very seriously. So yes, our approach to this is, our phrase is alert but not alarmed. We want to be seeing healthy people. We've put extra measures in place to help protect us from everyone else, and vice versa. I mean, we obviously want to remain fit ourselves, but we have to take this virus more seriously than other viruses that have come to Australia more recently, because if we all get this wrong, it's going to spread like the recent wildfires, and we want to, as a community, protect the community from that happening.